Hello and welcome to Change Lives. I'm Habiba Chevalier, your host, and we have a fabulous show for you with Promise to Care Pharmacy. And we want to thank you for being out there. Get your pad and pen ready because we have some information that you want to know about. Introducing my guest to my right. Mr. Reedus Smith III.
Correct.
CEO and founder of Promise to Care Pharmacy. Wonderful. And we have Mr. Reedus Smith IV with Promise to Care Pharmacy.
Yes, ma'am.
By any chance, does he belong to you?
They say he does.
He's very handsome.
Thank you.
And to my left, my co-host with us this evening, Russell Rivers. Thank you for coming, Russell.
You're more than welcome. Thanks a lot for inviting me, Habiba.
From the Tribune?
Yes, Tennessee Tribune.
Wonderful.
One and only.
Yes. So we have a fabulous show for you. And I want to start here with the CEO of Promise to Care Pharmacy.
Thank you.
Tell us a little bit about your purpose, how you got started. This is a wonderful vision that evidently God has given to you to help the people.
It goes back quite some time. And first of all, thank you for having us. You're absolutely the greatest host I've ever sat in front of.
Oh, thank you.
I thank God for calling you to do this. But Promise to Care came into its reality because we had a mission to want to help as many people as we could. I started out in hotels, believe it or not, and then was called to Memphis by a wonderful chief executive officer named Lucy Shaw to head up the Med and turn it into a hotel atmosphere. And from then it took off into healthcare and was approached one day by a gentleman to ask me to get into the pharmaceutical side of it. It was strictly a blessing. I struggled with it for a few days. And then we got involved in it because I had had the experience in hospitals and managed care and knew what was going on and wanted a different atmosphere. So I took all the things that I didn't like and fixed them and put them together and formed a pharmacy organization that I think is there strictly to help the people.
And I like your logo too. Saving time, saving money, saving lives. And you say, I promise.
Every day.
I love it. I love it. I love it.
It all came from an experience. I'm a stage 4 Crohn's patient. A couple of times there was a very big question as if I would see the next day or not. In our last experience, I told God that if he would raise me up, I promised that I would take care of as many people as I could and live by that code.
So that's where I Promise came from.
Yes. They took me home from the hospital the first discharge day because I wanted to see the office. And I drove up. I didn't drive up. They drove me up. I got out of the car, sat in the wheelchair, and as they were pushing me up, I noticed the name of our company was Ready Healthcare. So I called the meeting and we changed the name to Promise Care and then Promise to Care so I would never forget my vow that I made.
Well, that is
Great.
totally awesome. Totally awesome. Reedus the fourth.
Yes, ma'am.
I'm going to pose this question to you to start. How does a patient then sign up or enroll in Promise to Care?
A patient can sign up with us in multiple ways. If they see us in places such as TV, then we have a 877 number.
Give us that number, please.
That's 1-877-323-9067.
Did you get that number?
And they can call that from 8 to 5, and they'll always speak to a pharmacy tech or a diabetic specialist. They will never speak to anyone other than that. We don't go to an automatic voicemail. They always speak to a person. but they can also sign up through their doctor. We're throughout the city in doctor's offices with brochures. They can sign up at health fairs, which we're frequently at now. There's so many ways that they can sign up. We have an internet site, promisetocare.com they can go to, and they can sign up any of these ways.
Well, tell us about some of the other marketing tools that you have in Promise to Care.
We have a magazine that goes out quarterly.
Do you have that magazine?
I think I have it right here. I think you have the whole
Rivers?
package. Share the packet right there.
Yes.
Absolutely.
Hey, hold up that magazine. That is, and then your members, I assume, get a magazine?
Yes, ma'am. This magazine goes out quarterly. It reaches 250,000
Hold it
people.
up. That's really nice. Uh-huh.
On the cover is actually one of our affiliates, Dr. Roy Hinman, out of St. Augustine in Florida, military veteran. And we also have a newsletter that goes out once a month that reaches all of our patients as well. This has articles on health and just education that we try and teach all of our patients. And one of the biggest things that we have is the article in the Tennessee Tribune that was just done on us about a week ago. This is probably one of the greatest forms of marketing that we've had because it's got such a strong foothold in the Nashville market.
So it's going to have an impact on the people.
Yes, ma'am.
No doubt.
Yes, ma'am.
Okay, that's just wonderful. I just love what you're doing, and that is to help save lives, and in the convenience, actually, of just being in your own home, not having to go out to a pharmacy. That is definitely a great service.
We've enjoyed giving it. You literally, there's so many working moms now. There's so many people that are homebound, that are waiting on people to come by to see if they'll take them. Even our state system is somewhat not as adequate because you can only get one trip from the hospital, and that's either do you go home or do you stop by the pharmacy?
Exactly.
So people go home. We've learned that 57% of all the prescriptions written, especially from a hospital setting, are never filled. Wow. Because of the fact that it's copay, transportation issues, it's can I get there? You know, we even found some people that were cutting their strips in half to make them last longer. They don't have to do that. We deliver it right to the front door, or we overnight it to the next day. You know, we talk about copays. You know, we get 90-day supplies versus 30. All of these things to make sure that the people at home are convenient, and we educate our people.
Absolutely.
More than anything, we
strong.
educate them.
That's strong.
Well, you also have the elderly people that cannot get to the pharmacy.
Right.
And then we have the gas prices.
Yeah.
Gas prices, you know, I mean, to say the least, it's definitely a plus to have this convenient service.
Yes.
You know.
We think so. It seems to be working fairly well at this
Well,
point.
I know it works for me.
Absolutely. Well, let me ask you something, Rita. What effect will the Affordable Care Act have on your pharmacy? I mean, how can it really help the community at large throughout the country?
Well, I think, first of all, to answer your question directly, it will help us because more people will be covered. As you know, everybody has to receive some type of payment for their services. So we have a lot of our patients that are uncovered right now, people without insurance. That's why Promise to Care cash program through MD Save works so well, because in our community health initiative project that Paul, Kevin, and I came up with years ago, we came up with a cash price that's cost plus shipping administrative. We don't mark it up 400% and 500% like most people. The Affordable Care Act is going to give insurance to everybody. It's not going to be just the have and the have-nots.
Right.
It's going to be more of an equal playing field. Now, what that picture is going to look like, we all really don't know all of the pieces yet. But I think that if I had one message is to tell the people is to quit being scared. We're doing something rather than nothing now. And the fact is that you'll all be covered and you can all get your medicine now, and we really don't have to worry about if a person has coverage or not, or a form of payment or not. Now, what that form of payment is going to look like is still kind of testy. But for us, the pharmacy, we'll continue to do business like normal, almost.
Wow.
Well, let's go into that a little bit more in depth. Are all the insurance plans now accepted, and what are you accepting? Are you accepting cash pay, for instance, as well?
We accept all insurance companies. We do have a hardship program for those people who don't have quite the cash to pay for it. And I'll give you an example. And this breaks my heart, and I won't say her name because of HIPAA reasons. But we had one woman whose son was like me. He's a Crohn's. His medicine is $2,000 a syringe. Well, you have to take that for 18 weeks, one a week. I got that. So we had to call the manufacturer we almost threatened to the point that either you help them with this or we won't carry your product anymore. But the thing is she was working 3 jobs just to support her child's medication. The husband was working to take care of the regular household needs. So what we do is we go in and we try to help you get assistance from the manufacturer if possible. We accept co-pays and we accept payment terms, and we also try to give you a cash price that we know is affordable and you can live with.
Great.
We have one lady that her medicine's only $6 a month, but she sends us $4 faithfully every single month. You know, and the accountant was telling me, do you know by the time you're 65, she will still owe us? And I couldn't quit laughing about that. But every month, faithfully, you see these $4 $1 bills of valued customer. Man, I wouldn't trade it for anything in the world.
Well, I want to pose this to you. The 4th?
Yes, ma'am.
I like that. Is the cost then the same as, with your pharmacy as it is with other pharmacies out there on medications or most medications?
No, ma'am. We focus primarily on getting discounts for our patients.
Okay.
We don't want to take advantage of anybody. We don't want them to feel like they're struggling to get their medication. Okay. Our pharmacy greatly reduces the cost. For every $1 million a patient would spend over a lifetime, we can save them $270,000.
And you have discounts of up to 50% and more? Yes, ma'am, especially when it comes to generic drugs. We try and veer people off from thinking they have to have a brand name because that's what they know. If an aspirin has Bayer on it, then it's an aspirin. But if an aspirin that's generic is FDA approved, it's the same thing. Just one has a different label on there, but it's going to give you the same effects, but one's half the price. So we try and educate our patients through our classes, with our dietitians, and even our pharmacist speaks to so many patients a day, trying to let them know what they can do to save their own costs. Okay, now I know most people out there, our viewing audience, wants to know how long will it take them to get their medications? As soon as we receive the prescription, we send it out that day, and it's at their doorstep the next day. Specialty medications take an extra day because we have to order it in, but all specialty medications are there for 2 days, but other than that, it's there at your doorstep the next day. Let's give a contact number again, once again. That number is 877-323-9067.
And remember, I'd like to add to that, we are the first and only, we better be. We met with Federal Express, who we owe them a great deal for our overnight success. They came to the table and made things affordable for us. So they were the ones that heard what we were trying to do and made our overnight program so successful. And then it adds on to some people may travel to Arizona or New York, may get there and say, hey, I forgot my medicine. With Promise 2 Care customers, you're allowed 2 emergency overnights a year. Wow. Meaning if you left that med and we need to send it to a hotel or send it to your loved ones and you're vacationing, we get that out to you, and that's at no extra cost to you at all.
That is very, very special.
Strong. Right. Very strong.
Very, very special.
Now, I understand that you have a unique diabetic care plan, package or what have you, and it's very special. Can you just kind of share something about that?
I invented that. My father is probably the worst diabetic in the world, and we feel like if anything in the world could work, it would work on him. But before I got really into the business and noticed that, I noticed all these diabetic companies would give meters out by the thousands, just all in front of the stores everywhere. But they wouldn't give you any strips to use the meters because you had to go buy them at $48 a box, average. So I came back and talked to Cord and Jay Hampton, who's our Vice President of Operations for North America, and I said, I want to get a kit with the diabetic meter, testing meter, the strips, the control solution, the syringe, the Lancet device. Everything a diabetic could need in this one kit. So when they buy a kit from us, they don't have to go to any other store to shop for anything else. We sell that kit to the public for $19.95.
Wow.
For a box of 50 with everything included in it.
Wow. Hey, let's give that toll-free number again.
What's that number?
The number is 877-323-9067.
Wow. And we do that very, very good. And so that took away my anxieties of, I don't want our patients to come to us and go, I got a strips, and now I got to go buy control solutions. Now let me go to this store and get this. Now let me call my doctor and get it. Everything comes in the kit that they would need.
Wow.
And every time they reorder and get a refill, it's the same thing. You get a new meter once a year, whether you need it or not. And if we ever increase or go to an upgrade, all of our people are notified and customers, and they get the upgrade of the new meter at no charge.
Wow. What about the children in school?
Well, here's what I learned about that really aggravated me.
That's a good question.
We give kids a meter, and especially in middle class, in the poverty areas, a child gets 1 meter. Well, you have children.
Yes.
Here's this expensive meter. Do I let this kid take this meter to school? I mean, it's going to get broke, lost, misplaced. Then I got to go buy another one. Because remember, the insurance plans won't pay for but 1 a year. So we came up with a plan that's called Child in Care. If they're under 18 or in college and under 25, we send an extra meter to their school and notify the school with their parents' permission that they'll be tested, because so many kids do not get tested in the course of the entire day. So after they're eating lunch, there is no meter reading for them during that time.
Wow.
83% of all diabetic children that are in a formal education setting are not testing between the hours of 8 and 3.
That's strong. That's a strong product.
Yes. I'd like to talk a little bit more about your educational resources, Mr. Smith. Could you tell our viewing audiences about that education piece that you have?
Yes, ma'am.
Because I think that's very important. I was very impressed about your education resources, as well as your medication counseling. There isn't any place I know I can go if I need medication counseling that are filling my prescriptions.
Yes,
so this is very impressive.
Like I said, we have a consultation program. You speak directly to one of our pharmacists that's on staff. If you have any questions about your medication because of side effects, what's going on with it, when do you need to take it, do you take it with food, any question you have, you can speak to one of our pharmacists on staff. If it's after hours, they all have on-call phones that if it's an emergency, you can still speak to them. So you're never going to have to, wait a day or two to talk to your primary care doctor.
Well, I bet the doctors like that.
Yes, ma'am.
Oh, yeah, they do. 'Cause they don't get the phone calls anymore.
We also have registered dietitians on staff. They teach cooking classes, especially with our diabetics, because we want to make them feel like food is fun again. A lot of the time when you get put on a medication for anything, or when you're diagnosed as a diabetic, you automatically assume food isn't going to be fun anymore. You can't eat this, you can't eat that. But we have a program where you can send in your grocery list. Our dietitian and our pharmacist will work together. They X off things that you probably shouldn't have, and they substitute it with stuff that's going to still be fun for you, but it's also going to be healthy at the same time. So we teach classes, and we're out in health
What
fairs
are some of those
projecting this message.
classes you teach? What are the subjects that you cover?
We cover just overall health in one. The second, it's a strictly cooking class.
Wonderful.
We have prep areas set up, stoves set up, so we show you on hand how to cook certain meals, how to substitute things, and how to cook it the right way. And the third, we teach an exercise class.
Wonderful.
Yes, ma'am. So we
Did you get that number out there?
877-323-9067.
And I know you also have a cardiovascular class that you teach?
Yes, ma'am. We teach all kinds of classes. Just whatever we feel like needs to be focused on, we come up with a class, we come up with a game plan to attack that.
Okay, also smokers out there, there's a sensation.
Yes, yeah, smoking sensation.
Smoking sensation. You really want to get in on that.
We focus on, just if I may intervene a little bit, 23% of all diabetics that are assigned to Promise 2 Care are either completely off of insulin or have decreased insulin by 50%.
Wow. Say that again. We just need to hit it
23%. That's 23 out of every 100 people. If we could get the other 50% to comply like that 23% get, the number would be higher. And here goes. Dr. Roy Hinman invented what they call a triangular diet for us. Island Doctors in Florida probably is the greatest in the nation at this. Yeah. The average person on the triangular diet can lose 1 pound a day starting in day 3 for the period of the diet till they get to that what they call I think it's the word I'm looking for is their peak level or plateau. And then it goes on to another set. It's a very fun diet. The food is great. You don't have to go buy any special food. They can either go on www.islanddoctors.com and look at the triangular diet or call Promise 2 Care or look at Promise 2 Care and get it. We want you to do that whether you do business with us or not. Exercising and walking, we have Walk a Mile in My Shoe, where we get our customers to sign a statement saying they actually walked a mile every day for 90 days.
Wow.
We put their names in a basket and we draw one name, or it depends on how big the party is. Sometimes I'm gracious and it's 2. And they win a flat screen TV or something.
Wow.
And
so
we do
you, above everything else you do, you give prizes.
Yes, we do give prizes.
Incentives. There are incentives just to take good care of your own bodies.
Right.
That is awesome.
Sound like you're doing just the opposite of what the other pharmacists are doing and trying to create more people with more drugs, and you're trying to get people off of them.
We are excited when people tell us that they don't need us anymore.
Wow.
Because if they come to us and over that course, because of something we did, they don't do business with me anymore, believe it or not, I am very, very happy and blessed. Wow. I have done my job.
Great.
To God be the glory.
Thank you. And only be to him the glory.
What can the churches do as far as helping, help their congregations and membership get their medications and everything from you?
We have a very big community health initiative going on. We also have our education division who we hire to work for us called HERO, which is Health Education and Resource, to do that. The churches, the ministers have got to start taking time. A healthy congregation is a good, solid-minded congregation.
All right.
And they have to take the time to devote to health. Do you know it costs the pastor $27,000 to replace one church member?
Wow.
Seriously, there was a study done on it. And
that's incredible.
People who go to church on a continuous basis live 7 years longer than people who don't.
Wow.
There's something to that. I mean, that's statistically proven. But the pastors have got to start making time and quit doing the upper room with chicken, sweet potato pie, and all that. And that's good. But when the piece of pie you took is bigger than the piece you left behind,
Ooh.
you're probably wrong.
You're right.
You know, so we got to do that. And I think God can heal anything, but I also believe that our healing can come through doing what's right.
Great, great, great.
Well, Mr. Smith, any closing remarks? We have to wrap this up, but I want our viewing audience to know as much about Promise to Care in this show as we can possibly give them information. Once again, I would like for you to go ahead and give them the free toll-free number. Free toll-free number.
The toll-free number again is 877-323-9067. I think the biggest thing to project to the audience is we work for them. They're not going to have to spend time, money, and gas going to get their prescriptions. We work with them to create not only a healthy moment, but a healthy lifestyle for them that's going to last for years to come.
Great, great, great.
Well, any closing remarks?
My simple closing remarks would be, as the founder and the chairman of this great organization that God has allowed me the opportunity to be the leader of, I want everybody out there to really understand that Promise to Care is just what it means. We promise to take care of you in your need. We promise to take care of you in any situation that we can. You don't have to be a member or doing business with us if something arises that you feel like we can be there for you. We have pharmacists, counselors, nutritionists. We have health education for you, brochures. Just call and feel free. Look at our local location address up on the website. Come by and visit us and see if this is the type of family that you want to do business with. Because I can tell you this, I promise that we'll take care of you as if you were one of our family members.
Would you like to give us your website address?
The website address is www.promise2care.com.
And the address, the physical address?
The physical address is 501 Main Stream Drive, Nashville, Tennessee, 37228. Stop by anytime and ask for me if you like.
And that's in Metro Center, by the way.
Right across the street from the Falcons training camp.
Titans.
Titans. Oh. You can tell who I was rooting for Monday.
Well, once again, I like your slogan, saving time, saving money, saving lives. I think that's a great slogan, and you're keeping your promise.
Yes.
From what I hear here this afternoon, you are keeping that promise.
Job.
And you heard it here on Changed Lives, Promise to Care Pharmacy. So we thank you for being out there, and we thank God for the opportunity to share this very important information with you. We look forward to hearing from you real soon, and we thank you.